session is started already. I'm live. I think it's not visible. Now I think it's visible to you guys. Sorry for this technical issue. Sorry for this technical issue. Right. Let me know in the chat box, guys. Am I clearly audible and visible to everyone? Let me know. Am I clearly audible and visible? Just a minute. Yeah, it's visible, right? It's visible, right, guys? Let me know in the chat box, guys. Am I clearly audible and visible? Sorry for this disturbance. Let me know once in the chat box. Can you guys reply me in the chat? I think on my other screen I'm not visible clearly, guys. Yeah, my image is. What about now? Just a minute. Okay, my image is not visible. Okay, just a minute. Just a minute, guys. Give me a minute. What about now? What about now, guys? My image is clear now. Okay, okay. Just a minute, guys. PDF can be seen. Okay, now visible also. Okay, okay, doctor. Right? Clearly visible and audible, all okay, right? Should we start the session? Sorry for this technical interruptions. Now, okay, okay, guys. Sorry for this interruptions, right? Let's start. We was talking about the IPC 92, right? We was talking about the IPC 92, right? So what is in the conducted in the IPC 92? The IPC 92 is that the nothing is the offense, right? There is a nothing is the offense by the reason of any harm which is the may cause by the person who is the benefiting is the done in the good faith, right? So if this doctor, as in the MCQ they mentioned it, right? If this doctor is doing the surgery, if they're doing the surgery in the good faith because it is a necessary to do, right? I'm again showing you the MCQ. All right, I'm again showing you the MCQ that there is an 15-year-old unconscious male patient who present with the emergency department requiring the immediate surgical intervention, right? There is a surgical intervention is needed, right? It's clearly mentioned that it is a needed, right? And also the lacking of occupying this individual that who will do, right? Right, okay, to do this conditions, okay, so that they are asking you about it, that what to do in this condition. So guys, there is the operate without the consent should be the answer because it is under the IPC 92, and I already told you that if the circumstances are such that impossible for that person to the signifying the consent or the person is incapable to do give the consent, right? As I given you in the MCQ, right? The patient is not having any guardian will be there, the patient is not signifying to do this, giving this consent, like the patient in the MCQ they clearly mentioned the patient is unconscious there, right? Patient care unconscious, so this patient is unconscious, so now he cannot give the consent on it, right? So we have to do the surgery, right? So this is this is about your IPC 92, it is about your IPC 92, right? IPCs, yes, you have to remember the IPCs. You have to remember the IPCs, which is the important and which is the repeatedly time coming. You have to remember those. I'm not saying that you have to remember all the IPCs, right? I'm not saying to you, but which is the more important and frequently asked in your exam. So you have to remember that, right? You have to revise that. Perfect. Okay. Right. Should we move forward? I hope now it's perfect, right? Okay. Okay. Remember this. Remember this, right? Yeah, directly question will come in your exams, right? Perfect. Yeah, it's a hot topic. It's a hot topic, right? Remembering this is a good thing. Okay. The I'm not saying that remember all the thing, the all the IPCs and the CRPCs you have to remember, but the important one, which is the repetitively coming in the exams, you have to remember that. You have to remember that. Let's move forward for the next question, and the next question is in on your screen. Yes, the next is in your screen. Please try to reply me in the chat box the answer of it. One patient was brought to your emergency room, which with a history of unknown poisoning. Please remember the question like that. They are mentioning you the unknown poisoning. Okay, the patient is having what? The patient is having the unknown poisoning. On the examination, the needle track mark. Please remember the needle track marks are seen on the upper limb. What is the scene? The needle track marks over seen on the upper limb and increase the blood pressure. The patient is having the increased blood pressure. They mentioned you, and also there's an increased heart rate. The heart rate is also increasing, and the patient is also having the hyperthermia, guys. Patient is also having the hyperthermia, and now they are asking you that which poisoning is the suspected here. So by the giving this clinical scenario, guys, please try to reply me in the chat box. What should be your answer in this case? Please remember, guys, not you are replying the see the cannabis. Can you know about the how to use the cannabis? It can be the smoked, right? Like cannabis is using in the smoke, right? And the clearly mentioned that needle track marks. It means the patient is having the needle marks on the hand, on the upper limb, right? He's clearly mentioned there that patient is having what? The patient is having the needle track marks. Okay. I'm waiting for your answers, guys. Try to reply me. Try to reply me. The cannabis cannot be. Okay. The cannabis cannot be in these conditions. Okay. Very good. Very good. It will be your cocaine. Okay. Option is given you heroin, cocaine, cannabis, and LDS. Please understand this thing as it is increasing the blood pressure, increasing the heart rate, and the hyperthermia. Right? Yes, IV users. Right? And please remember this thing, the cocaine is having the dual work. What is having? The cocaine is having the dual work. One, it is on the lower dose. The cocaine is having some symptoms on the higher dose. Please remember what is happening in the lower dose. The lower dose will be going to always and always show you the increasing the sympathetic nervous system, right? So then sympathetic nervous system, what will be the scene? Increasing the blood pressure, increasing the heart rate, hyperthermia will be seen there, right? So please remember in this case, the answer should be your cocaine. The answer should be here your cocaine. So then the cocaine, this is the unknown poisoning of what? It's the unknown poisoning of cocaine, right? So patient is used the cocaine, right? Patient is used the cocaine in this condition, okay? So answer should be here cocaine, right? I hope you understand, right? So please remember, cocaine will be increasing what? Your sympathetic system, right? That is it increasing the sympathetic system. What it will be going to do? How it will be going to increase your sympathetic nervous system? By the inhibiting the sympathetic reuptake of epinephrine and the non-epinephrine. So what it will do? It will be going to inhibit. It will be going to inhibit the reuptake of epinephrine and the non-epinephrine. And what will be happen? They will be going to increase your heart rate, increasing your blood pressure, right? And they clearly mentioned you about the needle track appearance. Please remember, as the needle track appearance, yes, it will be the case of your IV drug abusers. IV drug abusers. So your answer should be your cocaine, right? Your answer should be your cocaine. Is it clear, guys? Is it clear to you? Should we move forward? Should we move forward, right? Okay, let's move forward for the next question. The next question is in front of your screen, right? In which type of hanging, the weight of head act as a constricting force? Now try to reply me in the chat box. It's question from your hanging part. Already the one question I already had from the topic of hanging, which is about the judicial hanging. But in this case, they are asking you different question in a different pattern. What they're asking you? They're asking, like, in which type of hanging weight of your head is act as a constricting force? The option is given your complete, option B is your partial, option C is your typical, and option D is your atypical. I'm waiting for your answers, guys. Please try to reply me in the chat box. Please try to reply me in the chat box. I'm waiting for your answers. Very good. Very good. Right. Very good. So it should be your partial, right? It should be what? It should be your partial hanging. Now, the thing is here, you have to know about the what is your complete hanging, what should be your partial hanging, right? So please understand the one thing. In the complete hanging, what will be happen? In the complete hanging, what? The body of the person should be completely in the air, not touching anything off the ground. Please remember, any part of body if touching the ground, it should be not the complete hanging, right? It should be not the complete hanging, right? It should be not the complete hanging. Complete hanging, no parts of the body should touch the ground. Okay, so please remember, we have to talk about it as they're asking about the head act as a constricting force. So it should be your partial hanging. It should be your partial hanging. So what should be the partial hanging? That's I'm going to show you. Right, partial hanging is also known as your incomplete. Right, as I shown you the two things, complete and incomplete. So what is the meaning of incomplete or the partial hanging? In the partial hanging, the some part of the body should touching the ground. Please remember, if the part of the body is touching the ground, it should be your incomplete hanging. So in the complete hanging, what will be happen? No part, right? Body part will be not going to touch on the ground. Please remember about it. And what is happening in this condition? Please remember what is happening in this condition, right? What is happening in this condition? That as the person, you can see on the image, I also put it image, you can see the person is touching on the ground, the person's knee is also touching on the ground. So the person's knee is also touching on the ground, so he's on the sitting on like a knee and having a hanging. You can see it is having the hanging on it. Okay, he's having the hanging on it, right? On this particular bamboo, right? He is hanging on this particular bamboo and he's touching, his feet is going to, knee is going to touching the ground. So it is an incomplete hanging. So now what is happening in the incomplete hanging? In the incomplete hanging, your constriction of the force, of your head weight, right? Weight of your head should be here constricting of the force, right? So please remember, the constriction of the force here should be your head, right? Weight of head. So weight of head should be your constricting force. Remember this, right? Okay, so this is about your partial hanging. This is about your partial hanging. What about your complete hanging? In the complete hanging, the body will going to not touch any part of the body, will be not going to touch any part of the body, will be not going to touch the ground. If you can say just toe is touching there, it is also count as a partial hanging or the incomplete hanging, right? Incomplete. Like I hope you remember about the Sushant Singh, right? Sushant Singh Rajput case. That was also the case of the partial hanging. That was case of the also partial hanging. They shows as the images you going to see that images is seen in there. It is showing like it is a partial hanging will be there, right? Because as they given the picture, the feet are touching on the ground there, right? So it was your partial hanging or the incomplete hanging, right? So remember about the hanging. Hanging is a very, very important topic, very, very important topic, repeatedly coming in the exam, So you have to remember about the hanging topic. Okay. Should we move forward, guys? Very good. Let's move forward for the next MCQ. And in the next MCQ, they mentioned you that that when a doctor receives the payment, what is happening, right? As you already know, when a doctor receives a payment in the exchange of referring the patient to the radiologist for the USG scan, right? I'm giving you the example, like you are a doctor, you are working, you're on your hospital, right? You are working on your hospital and you don't have the USG facility in your particular hospital, right? You don't have the particular so much big uh, center that you have the USG, MRI and CT scan, maybe the other scans also. So what you are doing, you are referring this patient to do the USG scan or the other scan to the radiologist to the on the other center, right? And what you are doing, and you are receiving the payment. That particular radiologist is giving you some split of that fees, right? Like out of this 1,000 rupees of the USG scan, he is giving you 300 rupees, 400 rupees, whatever the thing is there, right? If he is giving you money or payment, something about that, the exchanging of the, or referring the patient, you are referring the patient, you are taking the money, it is known as, they are asking you what it is known as. So the option are given here. The option A is that dodge me, option B is your medical malpractice, option C is the your criminal negligence, and option D is the commission, right? The some of you guys are thinking that they will ask you about the commission. No, The commission should be not the answer here. The commission should be not the answer here. Your answer should be your dichotomy, right? Dichotomy, right? Your answer should be your dichotomy, right? What is the meaning of dichotomy? Let's learn about it. It is a very important 2 to 3 times asking in the medical exams. So what is happening? The dichotomy is also known as your fee splitting, right? It is also the fee splitting only, right? So whatever the money they are taking from the patient, right, for the doing this USG scan, for doing this USG scan, so there's some part of that particular fee they are giving you amount they are giving to you, right? So this is known as your fee splitting, right? Fee splitting. So the example as already I given you. So example, if please remember about it, they can ask you anything from you, right? They can ask you anything to confuse you in the exam. Maybe like this question they asked in the recently in the previous year question, right? About the radiologist. Maybe they can ask you if they are taking you any receiving any giving commission from the any professional colleague, any professional colleague. It's not like that you are sending to the radiologist only, they will be machine. Maybe the cardiologist is there, you are sending the cardiology patient to him on the referring by yourself, and you are taking some fee splitting from them. That is also dichotomy is called. Or maybe from the manufacturer or trade for the drug applicants, right? Like that you are writing the same brand drug you are going to prescribe the patient to every time, and you are asking the money to the your manufacturer of that particular drug, or maybe trader of that drug, you are asking for that, or many any applicants, right? Any applicants from that particular manufacturer, you are asking you are getting some money from them rather than you are prescribing their drugs. That is also known as the dichotomy. And the dentist or the chemist also, right? Maybe some chemists are coming to you, and they are asking you that we will give some part of money to you, that's just prescribe that we have to go to on this medical store, or on this chemist shop, that you will going to take the drugs from there, right? So it is, this all is known as your dichotomy, right? Please remember. So maybe they can frame any kind of the question will be there, like you are a surgeon and the patient is coming to you and he's having some problems with related to the heart, and you're referring the patient to the cardiologist, and you are taking some money rather than the referring the exchange of it, you are receiving some money from that particular doctor or the colleague. So this will be known as your discharge, right? Please remember about it, right? This is a very important topic, right? Asked in the previous year, asked in the previous year. Okay, let's move forward. Let's move forward. The next is here, a man who present with the excessive craving of, the patient is having excessive craving of sexual intercourse is known as. So please remember, they are asking about the man. Okay, so this can be seen in the female also, right? Male and female both can be seen, right? So they are asking about the man, it means the male. So they are asking about that the male who is having the excessive craving of the sexual intercourse is known as what? It's known as what? Try to reply me in the chat box. I'm waiting for your answers. So very good, guys. Very good. Very good. Right? So option is given here, guys. Satyriasis. Option B is given here, the fetishism. Option C is your neophobia, and option D is your masochism. What should be your answer, guys? Very good. It will be your satyriasis. I hope you studied this about the sexual offense related to your forensic, right? Very well. So because every time one question is coming from this particular topic, right? So you have to read this topic very well. You have to read and remember this topic very well, right? So we'll talk about the other options also. All right. Can you tell me what about the female? If this question is framed like that, a woman who present with the excessive craving of sexual intercourse is known as. Can anyone of you now please answer me? If I'm changing this here, rather than the man, here is a woman is there. Okay. Now tell me what should be your answer, guys. I'm waiting for your answers. I'm waiting for your answers in the live. As I going to change here, as I change here, rather than the main man, they are going to ask you the same question in the format of woman, right? A woman who present with their excessive craving of the sexual intercourse is known as. Please try to reply me in the chat box. What should be your answer? What should be your answer? I'm waiting for your answers, guys. Try to reply. Very good. Very good. If they are asking about the woman, very good. It should be your Yes, it should be your nymphom. Very good, guys. Very good. If they are mentioned the woman, if they are mentioned the woman, right? So your answer should be nymphomania. And your answer should be your nymphomania. Very good. Very good. Please remember about it. But here, what they asked about the man. Please remember about it. They asked about the man. So your answer should be here satyriasis. Your answer should be here satyriasis. Right? Very good. Let's we'll talk about the all other things also. Very good, doctor. You're replying very well. You're replying very well. We'll talk about the fetichism also and the masochism. What is it? So the male, if male is having the uncontrollable or the excessive desire of the sexual intercourse, right? Sexual desire in the man, it is known as your satyriasis. It is known as what? It is known as your satyriasis, right? And if I'm talking about it other, the next is your fortyrism. What is your fortyrism? Please remember about it. In the fortyrism, what will be happening? The patient is doing what? The patient is touching or rubbing. The patient is touching or the rubbing once the genitalia up against the another person. And what it is doing? By the doing this touching and the rubbing in the sexual manner without any consent. Please remember, without any their consent to drive the sexual pleasure. It is the reach the orgasm, right? So the person is doing the touching, right, or rubbing, right, touching or rubbing the uh, person's genitalia, right? So that is known as a fortyrism. Please remember about it. Yes, touching and rubbing without the consent, right? Without consent is also right. Sexual manner without the consent, without their consent. Okay, so without their consent, if they are doing, that is known as your fortyrism. That is known as your fortyrism, right? The next, if I'm talking about the your nymphomania, right? In the nymphomania is what? Yes, your nymphomania is your uncontrollable. Your nymphomania is your uncontrollable or the excessive sexual desire in the woman. Okay, so please remember, if the man, it is a satyriasis, and the nymphomania, it is the female, right? Male satyriasis, female nymphomania. And the last is your masochism. The last word is your masochism. What is happening in the masochism? Yes, in this condition, what is happening in this, which the patient is having the sexual or other gratification depending on the suffering the physical pain or emulsion. So what is the patient? Yes, patient is getting the enjoying the receiving the pain, right? To getting the sexual sexually gratification. The patient is what the patient want. That patient is want to suffering the pain. The patient is want to do the physical pain or maybe the humiliation, but the patient what? Patient want to suffer. Patient is doing same, right? On there, right? Patient is not giving the pain. Patient is receiving the pain. Please remember about it. If the patient is receiving the pain, it will be your what? It will be your masochism. It should be your masochism. So please remember about it. Satyriasis, excessive sexual desire in the male or man. Nymphomania, it is uncontrollable or the excessive desire in the female or woman. And your fetichism, rubbing or touching the genitalia of the another person without the doing the any consent, without the consent, right, to reach the sexual pleasure or the orgasm, right? Orgasm, right? Last is your masochism, the patient to which is the for the sexually gratification. The patient is receiving the pain. Please remember, patient is what? Patient is doing the receiving the pain. It is known as your masochism. It is known as your masochism. All right. Should we move forward? All right, very good. Moving forward for the next MCQ. Please remember about this. They are asking about your sexual offense in the forensic. Always and always one MCQ from there. One MCQ from that topic. So please try to do this topic very well. Try to do this topic very well. The next MCQ is in front of you. In the case of drowning, what they mentioned in the case of drowning, finding is seen, which is the image, during the autopsy, what it is known as. So they are asking about what this is known as. The person image is shown to you, and you can see in this condition, what is happened here. The patient is having the fish. In the patient's fish, what is we are having the grass or maybe some parts or the roots of the plants in the which is growing in the water, right? So it is having in the hand. So please can you let me know what is this known as, this particular case of the drowning? You already know, right? It is a case of drowning, right? So what this finding is known as, the option is given here. Option A is your cadaveric spasm, option B is your cutaneous anesthesia, option C is your rigor mortis, and option D is your washerwoman's hand. Washerwoman's hand. I'm waiting for your answers, guys. Very good. Very good. Right. Very good, guys. It is your answer, your cadaveric spasm. What answer? Yes, your answer should be your cadaveric spasm. Then what about their rigor mortis? Can anyone of you can tell me what about their rigor mortis? I'm going to tell you washerwoman hand. What will be happen if the hand is remain in the water? For as in the case of the drowning, the this particular hand will be remaining in the water for the more time. So what is happening for this skin will be getting not the flat. It will be getting the elevations there, right? So it is looking like that the washerwoman, right, who is washing the clothes, right? So they're having the hands in the more over time in the water, right? So they are also getting the same hand. So it is the washerwoman hands, right? I hope you know about it. What about the rigor mortis? What about the rigor mortis, guys? Why it is not the rigor mortis? What is the mean of rigor mortis, guys? I'm waiting for your answers. What is the mean of rigor mortis, guys? It is also the type of your postmortem stiffening, guys. Yes or no? So muscle will be going to stiff, right? Muscle will be going to stiff in the rigor mortis, right? The same thing is happening here also, right? The fist is there only, right? So the your fist is like there only, and he's having the grass in it, right? Why not the rigor mortis is here? The my question is here. Why only the your cadaveric spasm, not the rigor mortis, not the rigor mortis? Anyone of you? Anyone of you guys can reply me in the chat box. Yeah, rigor mortis is the rigidity of the muscles, right? Then why not the your cadaveric rigidity stiff because of ATP? Okay, okay. Just thing I'm going to tell you. Just I'm going to clarify you this thing only that you will not going to confuse if they're asking you question related to this cadaveric spasm or your rigor mortis. So you will be not going to answer. Please remember, in the cases of the drowning, there is a cadaveric rigidity should be seen. The cadaveric spasm, all right, should be seen. Okay, now please understand the thing. What is the mean of cadaveric spasm? I can understand that your rigor mortis, is also in the rigor mortis is also what is happening. There is a postmortem stiffening of the muscle is happening, right? Yes, depending on the your eight from the ATP from the muscle. Very good, doctor. Very good. You are replying very well. Right. Very good. Primary relaxation nahi hai. Very good. Very good. Please understand this thing. Please understand this thing. Right. I hope you got my point. What I'm going to ask you, that in the cadaveric spasm, in the condition that which group of muscle, what is happening? Which group of muscle is that will be going to used profusely just before the death? So in the cadaveric spasm, the muscles will be going to stiff. The muscles will be going to stiff. Which group of muscles are used profusely just before the that, and it will be become stiff and rigid immediately after the that, right? So there will be the no primary relaxation. There is a no primary relaxation will be not there. Very good, doctor. So this is in the cadaveric spasm, as you can understand. So why in the drowning cases the cadaveric spasm is seen? The cadaveric spasm because in the drowning time, as the drowning is there, the person is trying to do escape from it, right? So he's trying to do with the hands and legs. So sometimes what is happening, this is the getting grabbing the all the things. So what is happening, this all the plants and the grass will be remain in the hand of that person, and the fist will be remaining stiff there, right? So it will be getting stiff, this muscles will be getting stiff there just before the just after the that, immediately there will be the scene, right? Immediately just after the that, there will be this rigidity will be seen. So this is known as your cadaveric spasm. This is known as your cadaveric spasm. Okay. Yes, right. I hope you understand this thing. I hope you will remember now this MCQ very well, right? Should we move forward? Should we move forward? Very good. Very good. Let's move forward for the next MCQ. And the next MCQ is on your screen, that identify the order produced by the changes seen in the image below. So this particularly image which is shown you, so they are asking about the order of this particular changes. So what is kind of this changes, guys? You already know what is the kind of this changes, right? It is the petrification. Is it the petrification, guys? Let me know in the chat box. Is it the petrification? Yes or no? Is it the petrification? Then what? If it is not the petrification, then what? Tell me in the chat box. Is it the petrification? I am asking you this. Yes or no? Is it the petrification? No. Very good. In the petrification, it will be having more predator, right? Very good. Then what is it? If it is not the petrification, what is it? Very good, guys. It is your mummification. It is your mummification. As you already know, the mummification is from your word from the Egypt, right? In Egypt, what they are doing, they are preserving this dead bodies. What they guys doing? They are doing the preservation of this dead bodies, right? It is a type of preservation of the dead bodies, and for the doing this preservation of these bodies, they are doing the preservation of the dead bodies, right? And they are following this particular mummification. Very good. And now tell me, is the mummification is having which kind of order, guys? Is it having any order? No. Very good, guys. It is not having any order. It is your orderless. What? It is your orderless. Very good, right? So it is what? It is your orderless. It is not having any kind of order. Please, you can understand this thing. The mummification is the process to preserve the dead bodies, okay, to preserve the dead bodies, right? Understood? Okay, so there is a no order will be there. There is a no order will be there particularly, okay. Very good, very good, okay. So the orderless, please remember this will be the orderless, and it is mummified the body, so no order will be present there, right? In the mummification of the bodies, there will be the no order will be there. Just a minute, guys, just a minute. Pen is not working. Just a minute, guys. Give me a minute. Sorry for this disturbance. I don't know what is happening today. The technical issues are more today. I don't know why. Sorry for this, guys. Sorry for this. I think now it's clear. I think now it's clear. I think no. Just a minute. Okay, perfect, right? Now is it okay? Okay. Sorry for this. Sorry for this. Okay. So we was talking about the question about the mummification. Just a minute. I will show you the question on your screen. Yeah, this was the question, right? Sure, sure. Sorry for this disturbance. Sorry for this disturbance, guys. We were talking about this mummification, particularly this topic of mummification, and what was the question they are asking you? They are asking us about the order of it. So please remember the order should be here. Order should be your orderless. Okay, so it should be your orderless. It should be your orderless. Okay, yeah, it should be your orderless, right? Very good. Let's move forward for the next question. And please remember, as the mummified body is there, remember in the mummified body, no order present, no order. Okay, so answer should be always orderless. Mummification body, mummified bodies, no order, right? If the petrified body is there, then petrient order, right? Petrient order will be seen there. Perfect. Very good. Let's move for the next question. And in the next question, what they are asking, identify the postmortem finding. Identify the postmortem finding shown in the image the patient have history of chest injury. So they are asking you about the postmortem finding. The two keywords are here. They are asking about the postmortem finding, and with the postmortem finding, they are asking you about it. They're given you that the patient have the history of the chest injury. And what should be your answer, guys? Can you tell me? Option A is your cardiac tamponade. Option B is your fat necrosis. Option C is your hemothorax, and option D is given as your pulmonary embolism. Guys, I'm waiting for your answers. What should be your answer? What should be your answer from your side? What will be the answer from your side? Is it fat necrosis? The necrosis should be not, because they are clearly given you that history of the patient is having the history of chest injury, right? So yes, your answer should be here. Yes, your answer should be here. Very good. Your answer should be here cardiac tamponade. Your answer should be here cardiac tamponade. Cardiac tamponade. Okay. So what is the mean of cardiac tamponade? Do you know about it? What is the mean of cardiac tamponade? Any one of you? Just remember about it. What is the mean of your cardiac tamponade? Please remember, the cardiac tamponade is an emergency condition. Okay. The cardiac tamponade is an emergency condition that take place, that abnormal amount of what is happening, that abnormal amounts of fluid going to accumulate it. The more over the fluid will be going to accumulate it in the pericardial sac. What is the mean of pericardial sac? As you know, epicardium, pericardium, endocardium, and myocardium. They have three layers. Pericardium, the outermost, right? Pericardium is the outermost, right? And pericardium. Now the pericardium is having the sac between it, and this pericardial sac is the having the more over the fluid will be accumulated there. And due to this accumulation of this fluid, what is happening? They will be going to compress the heart, and it will be going to leading the decreasing the cardiac output and leading to the shock. Okay, so the patient will be going to die from the shock. As the clearly mentioned in the MCQ, the person is having the chest injury. What is they mentioned? The person is had the chest injury, right? Person is had the chest injury. So what has happened? Due to this chest injury, there is a sudden accumulation of fluid. Maybe the blood can be there, maybe the other fluid can be seen there, right? So the pericardial fluid will be increased there, and due to this due to this, there will be the your pericardial, due to this, your pericardial sac will be compressing the heart. Now this fluid which is accumulated there, it will be going to compress the heart, and due to making the compression of it, there is a decreasing in your cardiac output. They are going to decreasing your cardiac output, and there the patient will be die from the shock. The patient will be going to die from the shock, right? So if we're talking about it in the cardiac, in the chest injury or in the cardiac tamponade, the patient is died from due to the, because of the less cardiac output, the patient will be going into the under the shock. Okay, so patient is dying from the shock. Okay, very. Let's move forward for the next MCQ, right? Let's move forward for the next MCQ, and they clearly given you the MCQ. In this particularly MCQ, they given the image based MCQ. What they're asking, the identify the task shown in the image. So they given you an image, right? They given you an image of the task microscopic slide. You can see here, this is from the microscope, and they are asking you particularly what they are going to ask you particularly, that which test is it? I'm waiting for your answer, guys. Please try to reply me in the chat box that which test is it? Is it as a Barberou's test, which I shown you earlier also? Next is the fluorescent test, then Takayama test, and the Techman test. Right? Option D is your Techman test. Takayama, Techman. What should be your answer, guys, here? What should be your answer? I'm waiting for your answers, guys. I'm waiting for your answers. Any one of you? Any one of you, guys? Is it the Barberou's test? No, guys. No, doctor. I already told you in the Barberou's test, we are going to see the yellow needle color shaped. I shown you the image of it. I shown you the image of the Barberou's test also. What we saw there? We saw the Barberou's test is done for the semen, right? Sperm. We're doing for the semen sperm, right? But here, if I'm talking about it, it is not the same sperm, right? Takayama, also no, right? What is the sure answer, guys? Please remember, your correct answer should be your Techman test. This is your Techman test. And what is this Techman test? Now, please understand this thing. Check this image clearly. Check this image. I'm going to zoom in this image, and you're going to see here, right? You guys going to see here, guys. What you guys seeing? Are you seeing the yellow color needle shape? No, you are not seeing any yellow color needle shape here. So how you can answer this Barbier test? It cannot be the Barbier test. It cannot be the Barbier. What we are seeing the brown color. Very good. Brown pigmentation or the red color pigmentations you guys are seeing here in this condition. So please remember, it is your Tickman test. And if I'm talking about this specifically about the Tickman test, we have to talk about this, about their Tickman test. So what is happening in the Tickman test? It is a confirmatory test. Please guys remember, it is always and always remember, it is a kind of your, right, it is a kind of your confirmatory test. Please remember, it is not the screening test, it is your confirmatory. For the making the confirmatory test, we are doing the Tickman test. We are doing the Tickman test for the blood, right? For the blood, it is not for the semen. But rather than the Barbios, we talk about the Barbios. Barbios is done for the your sperm, right? And it is for the blood. It is for the your blood. And on the formation of this differencing, the Hickman crystals, your definitive Hickman, your Hamilton crystals that are viewed under the microscope, the reagent are typically your sodium chloride. Please remember the reagent. If I'm talking about the reagent, please remember there was the pitric acid was there, right? In the your Barbios test, the pitric acid was your reagent. If I'm talking about here, what will be the your in this Tickman test, what should be your reagent? Sodium chloride and your glacial acetic acid. Okay, right? So this should be your Tickman test. Please remember about it. It is a kind of confirmatory test, right? From the, any kind of definitive stains of the blood should be there mentioned there. So we have to see that it is particularly, it is for the particularly for the confirmation of the blood. Okay, confirmation of the blood. Should we move forward, guys? Right, very good. Let's move forward. Let's move forward. Talking about the next. Talking about the next, that which of the following techniques is considered as the abnormal when used on the criminal abortion, right? Which should be the technique considered as the abnormal or when used as for the criminal abortion? For the criminal abortion, which technique is the considered abnormal, not the normal things, right? So the options are given to you, right? Please first understand the thing. Criminal abortion, that without the consent, right? Doing the any without the consent, if there is a doing any kind of abortion will be there, it is known as the criminal consent. It is known as the criminal consent. For the criminal consent, options are given there, which is the abnormal, which is not the good or not the normal things. The option A is the dilatation and curettage. So I hope you can understand about the dilatation and curettage is the normal thing, right? For the doing this medical abortion also, for the medical abortion also, we are following the dilatation and curettage. The next option B is your mifepristone. That mifepristone is your drug, right? Mifepristone is the drug, and it can be also the followed by the doing this abortion in the medical termination also. The option C is the abortion stick. Guys, the abortion stick is not the normal, right? Abortion stick is not the normal thing. So this is the kind of the abnormal is seen here. The next is your vacuum aspiration. It is also done earlier, but it is okay. If I'm talking about the comparison with the abortion stick and the vacuum aspiration, so abortion stick is more over the all this, right? It is a very old method. It is used in the by the ruler persons or the ruler women's, right? They are prescribing this thing, these things to the woman to do this criminal abortions, right? To do the criminal abortion. So if we're talking about this abortionistic, if I'm going to talk about this abortionistic, please remember, not done. It is not done as nowadays. It is not done nowadays. It was a very old method. It was a very old method, but nowadays also it can be seen in your rural areas, right? In some backward or rural areas, this method is sometimes they are guys following like that. Okay. So what is happening in this abortionistic? Please remember about this abortionistic. What is this? What is this abortionistic? Right? Importance about this abortionistic. What the guys are doing? They are using the wooden or the bamboo stick. First of all, they were taking about a stick of the wooden or maybe the bamboo, right? And it is the how much the length of it? The from the 12 to 18 centimeter of the long. And then what they guys are doing? They are wrapping up. They are wrapping on the one hand or the one end of this stick. They are wrapping up with the cotton, wool, or the piece of cloth, right? They are putting it with the cotton, wool, or the piece of cloth, and after that they are soaking this particular piece of this cloth or this and which is the last end. They are soaking with it what? Your marking nut, juices of marking nut, calotropis. They can use anyone. Okay, calotropis is more common, right? Or maybe the paste made up of your arsenic oxide or the lead. Okay, so they guys are what they are doing. Any of it, any one of it, they can use. The most common is your calotropis, right? I hope you remember about it. They most commonly what using? They are using the calotropis juice, right? They are using the calotropis juice, and after the putting this, after the soaking this stick in this particular juices, they are putting it into the uterus, right? They are putting it to the uterus. It is a very painful, yes, of course it is a very painful. Sometime in the due to this there is a causing of the more bleeding will be seen there, and due to this the patient can die, right? Yeah, calotropis is more cost more commonly used because it is a easily, not the kind of the easily, marking nut is also easily available, doctor. Marking nut is also easily available, right? So you can take out of the marking nut also. But yes, the calotropis is more commonly used, right? More commonly, right? Calotropis is more commonly used. Okay, guys. So this is about your abortion stick. Please remember about it. It is already nowadays not following. Very old method. Very old method. Nowadays not followed. Okay, not followed. Okay. Very good. Should we move forward, guys? Very good. Should we move forward? Okay. Let's move forward for the next question. And in the question, they are asking you, in which of the following the lucid interval is seen? I hope you know about the lucid interval. We already talked about it, the lucid interval, in a radiology session also. All right. Uh, and they are asking about it, in which of the following the lucid interval is seen. An option is given. Option A is your subdural hemorrhage. Option B is your parenchymal hemorrhage. Option C is your epidural hematoma. And option D is your subarachnoid hemorrhage. So from this particular question, from your lucid interval, they ask more over the question. So please remember about the lucid interval is a very important topic. Very good, guys. Very good. You guys are answering very well. What about the others? I'm seeing there is a more over the 20, 25 students are watching live. You guys are not replying. Just only 5, 7, 10 students are repeatedly replying the answers. What about the others who guys are watching live? Please try to reply your answers in the chat box. Okay. Try to reply me in the chat box. Okay. Yes. Very good. So what is the mean of a lucid interval? The person is going to the unconscious, then the patient is coming in the conscious, and again the patient is going to unconscious. So it is an interval, right? It is a interval between the two unconsciousness, because the patient will be going to unconscious, like first the injury will be there, the patient will be going to unconscious, then the patient will be coming again conscious, and after this consciousness the patient will again going into the unconsciousness. So it is an interval between this two unconsciousness, right? So what is the lucid interval definition? The time between the two the interval, or this the time between the two unconsciousness is known as your lucid interval. This is known as your lucid interval. And please remember, the lucid interval is seen in your epidural hemorrhage. The lucid interval is seen in your epidural hematoma, you can say, or the hemorrhage, right? As the hemorrhage will be seen there, right? Due to the hemorrhage, the hematoma will be seen there, right? So you can see, right? Very good. Okay, so you can see that it is seen in the lucid interval, always seen in your epidural hemorrhage or epidural hematoma. Epidural hematoma. Very good, guys. Very good. I am going to tell you this thing also, right? What is the mean of this your epidural hematoma? Just check it out here. And epidural hematoma, which is your EDH, also short form is known as, sometimes they what is happening, the examiner directly they mentioning you SDH, EDH, SAH, right? Subarachnoid hemorrhage, SAH. Subdural hemorrhage, SDH, epidural hemorrhage, EDH. So please remember, if they are mentioning the short form also, so you have to remember with it. We have to remember with this short forms also. And it is a bleeding between what? It is a bleeding between the skull, which is the bony layer, and the outer covering. Outer covering what? What is the brain? The outer covering? Yes, your dura mater. So what is the bleeding? Where will be the hematoma? Yes, your hematoma will be between the your skull, which is your bony cavity, and it will remain between the your dura mater. So dura mater and the skull. In between, if the bleeding is there, it is known as your extradural hemorrhage or epidural hemorrhage. It is known as your epidural hemorrhage, right? So this and the epidural hemorrhage. What is the scene? Yes, it is a scene, the idly shaped, right? Epidural hemorrhage is seen as a idly shaped on the CT scan. You can see on the CT scan it is a seen. And if we're talking about it, if we're talking about the EDS most common, so it is due to the your middle your medial meningeal artery. Very good. It is due to the medial meningeal, right? We'll talk about the medial meningeal also. They asked this medial meningeal question about the epidural hemorrhage. We'll talk about it. So it this ideally shaped, or you can say the yes, you can say the biconvex shape also. You can say the biconvex shape also. And this is the particular image, or the CT will be seen on your epidural hematoma, or the EDH. Please remember about the EDH, right? So this is between the skull and your dura mater. Please remember about the lucid interval. Lucid interval is classically seen in your epidural hematoma. Epidural hematoma. Right? If you guys having any query related to this sessions, regarding some MCQ or related to some any kind of help, so you guys can contact me on my social medias handle. So you can see my Instagram handle is given to you. My Instagram handle is dr.vaibhav Ahuja is there. If you guys are not using Instagram nowadays, as exam is near, I hope you stopped using this Instagram. So you guys can contact me personally directly on my Telegram also. My Telegram username is also here, Dr. Vaibhav also, right? Just difference is only between the Instagram and Telegram. Just one a dot is given in the here on the Instagram, right? Okay, so you guys can follow me on Instagram also, and if have any queries, you guys can contact me on this both social medias, right? Let's move forward for the next MCQ. Let's move forward for the next MCQ. And in this question, they are asking that what is the maximum gestational age? They're asking you about the what is the maximum gestational age at, right, as which medical termination of the pregnancy is permitted, right? Right. So, what is the maximum gestational age at the medical termination of the pregnancy is permitted, right? So, now we are talking about the medical termination, not about the criminal, okay? Not the criminal one. We are talking about the medical termination. And in this medical termination, what will be the age of the gestation should be allowed in? Guys, anyone of you can reply me? Can anyone of you guys can reply me? I'm waiting for your answers, guys. Option is given. Option A, 28 weeks. Option B is given 22 weeks. Option C is given 24 weeks. And option D is your 16 weeks. Very good, guys. Very good. Your answer should be always 24 weeks. As per the new MTP Act, right? What is the meaning of MTP? Medical Termination of Pregnancy Act is there. So, through this MTP Act, they given the 24 weeks. Okay, what they given? They given the 24 weeks of it, right? And please remember, if they are not mentioned the 24, what is the minimum? The minimum age, like medical termination, from the 20 to the 24, they given like that. Okay, so we can do the right. Yeah, the OCP, yes, OCP failure can be done for this, right? Less than, of course, the less than 24 will be there in the gestation age. So they mentioned that what? They mentioned 20 to 24. Between the 20 to 24 week, we can do the medical termination of the pregnancy is permitted in India. Please remember about it. Okay. So this is about the your related to your medical termination or the MTP. So related to this, please remember about the MTP Act. Related to this, about the remember about your MTP Act as your MTP Act. What is the mean of your MTP Act? Medical termination of pregnancy, right? Medical termination of the pregnancy, right? Very good. Should we move forward? Right? So MTP Act, what is the mean of MTP Act? MTP Act is allow the abortion till the 24 weeks. Please remember about the 24 weeks. Okay. So it's till the 24 week. Okay. Please remember it is medical termination. Okay. Let's move forward. Let's move forward. Again, guys, I don't know what is happening today. Is more and more about the technical issues are there. Just a minute, guys. Give me a minute. The pen is not working. I think I have to restart this software of touchpad. Just a minute. It will be seen to you. Just a minute. Give me a minute. Sorry for this disturbance. Sorry for this disturbance. Right. I hope it's clearly visible to you now. I hope it's clearly visible to you now. Right. Sorry for this disturbance, guys. Literally, what is happening in the due to this such issues, you are also getting lose your flow and literally I'm also losing my flow of teaching, right? You are losing the flow of studying, and I'm losing for the teaching, right? Both flows will be getting distracted here. Okay, it's back here, I think. Yeah. Okay, so we talked about this MTP Act. We was talking about. Yeah, sure. You are here for this session. It's grateful for me, right? It's grateful, right? So we was talking about this MTP Act, right? So please remember, it's from the 24 week. If they are mentioning you that, please remember 20 to 24 weeks. If talking about the range, it will be from the 20 to 24 of the weeks, right? Should we move forward for the next question, guys? Should we move forward for the next question? Very good. Very good. Let's move forward for the next question is on your screen. A male boy, right? What is the question, right? A male present, I think directly I have to write. Yeah. A male boy, it means they want to define you about the ages, right? A male present to your emergency room with the history of drug abuse in a party, right? So the patient which is coming to in your OPDs or your in your in particularly into your emergency room, what is the clinical case is given that he's abused any drug in the party and having the symptom. The patient is having the particular symptom of again headache, anxiety, and having the hyperactivity tachycardia. Now, please understand tachycardia, it means increasing the heart rate is available there, right? Increasing the heart rate. And also, what is the same? Hypertension is seen. The patient is having the moreover, the blood pressure is very high and his pupil were dilated and fixed. Please remember about it. The pupil is dilated and the fixed, right? The pupil is the dilated and the fixed, right? Which substance have been taken, and the option is given: option A alcohol, option B cocaine, option C opioid, and option D is your cannabis. The option D is your cannabis is given to you, guys. I'm waiting for your answers. Please try to reply me in the chat box what should be the answers. Some are replying B, some are replying D. Not, it should be not the cannabis, guys. Please understand the thing. It should be not the cannabis. Again, the same thing which I already given you, already told you about the sympathetic stimulation, right? The stimulation of your sympathetic system, right? The sympathetic aggravate, you can say, right? Symptoms, right? So you can see this, all the things are your sympathetic nervous system stimulation, right? So the patient is having again the used of what? Again the cocaine. So now you can see the 2 times the question is repeated here from the cocaine. So the cocaine is very important. Again, I think you know about it. They can show you a image of black tongue is there, right? The tongue is totally black, right? And they can ask you about that. The person is used which substance in this condition, right? More use of which substance, the tongue will be seen the black color, right? So which is known as your jad black tongue, right? Which is also known as jad black tongue, right? So I hope you have to remember with this jad black tongue. The jad black tongue is also seen in your which condition? In the use, moreover use of your cocaine, right? In the cocaine intoxication or in the moreover use of cocaine, what will be the scene? Your jet black tongue, right? Jet black tongue. If you guys just wait, I can show you the image. Just a minute. Just a minute. Cocaine tongue. Okay. So the cocaine tongue is your jet black tongue. I can show you just a minute. Just a minute, guys. Just a minute. I'm trying to find a good image of jet black tongue so you guys can identify it clearly. Yeah, it's here. Okay, so you guys can see this particular image also. They can ask you this image based question also, that jet black tongue is seen in what? Jet black tongue is seen in what? Your cocaine, right? In seen in your cocaine abusers, right? So remember this also, right? So remember this also. Okay, jet black tongue. Okay, so this is the moreover use of cocaine. The patient will be going to see the jet black tongue. Jet black tongue. Perfect. Right, so we completed about the cocaine, and again please remember about the cocaine, as we already talked about it. It is what? It is your cocaine will going to increase your sympathetic reuptake. What it will be going to do? It will be going to increase your sympathetic reuptake of epinephrine and non-epinephrine, right? It will inhibit, right? As it is going to inhibit, so what will be happen? It will increase the your sympathetic system. It will be going to stimulate your what? It will be going to stimulate our sympathetic system. It will be going to stimulate the sympathetic system, right? Very good, very good. Let's talk about it. Let's talk about it. The next question is in front of you. Again, just a minute, guys. This app will be right. So remember about the cocaine. Very important topic. Please remember about this cocaine topic very well. Okay, very important topic related to the cocaine. You have to remember, right? Let's talk about the next MCQ. We are talking about the next MCQ, right? The next MCQ is given to you. Okay, the next MCQ is given to you. Yeah, the screen is visible now. Perfect. Okay, so now the question is mentioned here. Now the question is mentioned here that after the 72 hours of cessation of the alcohol, the person is now drop the alcohol, or the cessation of the alcohol is seen here. And due to this cessation of the alcohol, there is this after the 72 hours, which of the following withdrawal symptom? So I hope you know about the all the withdrawal symptom of alcohol withdrawal symptom, and they clearly mentioned you the date or time also, that after the 72 hours. What they mentioned, guys? They mentioned you about that after the 72 hours of cessation of your alcohol, right? So what will be the answers, guys? I'm waiting for your answers in the chat box. I'm waiting for your answers. Very good, very good. Everyone replying very well. It should be scissors. No, no, no. It should be not the scissors. Yes, tremors should be there. Which kind of tremors? Delirium tremors. Very good. Your answer should be what? Your answer should be your delirium tremors should be seen there. About the hallucination and other, it will be seen the later, but in the after the 72 hours, the first symptom will be seen in your delirium tremors. Delirium tremors. So what is the mean of this your delirium tremors? If we're talking about it, your delirium tremors is the most your delirium tremors is the most severe form of your ethanol withdrawal, which is your alcohol withdrawal, right? Manifested by your under the mental status, which is your global confusion, which is causing your what? Global confusion. And your sympathetic overdrive, which is your autonomic hyperactivity, can be progressed to the cardiovascular collapse. Minor alcohol withdrawal is characterized by the tremor, anxiety, nausea, vomiting, and insomnia only. Okay, so if the patient is having the minor alcohol withdrawal symptoms, so in the minor, what we are having in the minor, we are concluding the tremors, simply nausea, vomiting, and insomnia will be there. But if we're talking about the particularly, so it will be the in the scene in the cessation of your alcohol, the patient will be having the delirium tremors, right? So it will be the question from the your alcohol part. The next question is in front of you, and again this question from your sexual offense forensic, right? From your sexual offense of the forensic. Now try to reply me in the chat box. They clearly mentioned that a man who consistently drive for the sexual pleasure from the causing pain, harm on his partner. Okay, so what it is doing, he is causing the pain and your harm to his partner, not to him, on the partner. He's not receiving the pain, guys. Please remember about it. Receiving the pain was we talked about it. That was the masochism. What was the masochism? In the masochism, the patient want to receive the pain, right? Receive the pain in the masochism. But here they're asking that he's harming on his partner, right? Often resulting the cuts and the burns on their arm. So what you can understand the thing, it is a physical harm, right? So what they are doing, they are cutting and the burning his arm and getting the sexual pleasure from it. What term is this behavior is known as? So guys, please remember this particular behavior is known as your sadism. What is known as your sadism? Okay, so this is a sadism, and we talk about the same, the masochism. In the masochism, the patient will be going to receive the pain, okay. Through the receiving the pain, the patient is getting what? The patient is getting the sexual desire or the sexual pleasure. The sexual pleasure will be there, right? If we're talking about the sadism, in the sadism, he's hitting or the beating his partner. Okay, so he's cutting the hands or the burning the arms, or maybe he's slapping, or maybe he's kicking, whatever the thing is there. So he is physically harming the totally. He is physically harming the his partner. Okay, if we're talking about the next, about the next is your voyeurism. What is the meaning of voyeurism? In the voyeurism, the patient is what? It is voyeurism. It means the visual, right? The patient is getting the seeing the private acts like peeing, or maybe the doing the peeing, or maybe the doing the something other, or maybe the taking the bath, or maybe other things, by the seeing this patients, by the seeing this other person's activities, the private activities, please remember. So by the seeing this private activities of the patient, the person is getting, the person is getting the seeing, by the seeing only, by the visual only is getting the sexual pleasure, right? So this is known as your voyeurism. What about the fetishism, guys? What are the fetishism, guys? Any one of you? What do you mean by the fetishism? I'm waiting for your answers, guys. What is the meaning of your fetishism? What do you mean by the fetishism? Any one of you? We talked about it, right? We talked about the fetishism. I'm waiting for your answers. Fetishism. Any one of you about the fetishism? Tell me. Yes. What is the meaning of fetishism? Yes. Any other object rather than the sexual organs. Okay. Any other object other than the sexual organs. Very good. Any other object of the desire. Very good, doctors, right? That is your fetishism. So this is about the your, again I'm mentioning you that about from your forensic sexual offense, of the forensic sexual offense, they are again and again asking you questions. So please remember about it. Please remember about it. Yes. Other objects, right? Yes, fetishism is from the other gratification by the objects. Okay, sexual gratification by the objects. Okay, rather than, please remember, the mention in the fetishism, there will be the, in the fetishism there will be the other body parts or any other object rather other than the sexual organs. Okay, understood? Very good, very perfect. Let's move forward. As the sadism is mentioned there, the your deviation of the sexual gratification from the physically pain on another person, right? So beating the partner, hitting anything, it's the on the partner is will be your sadism, in accompanying in the your sadism. Okay, perfect. Should we move forward? Okay. Next question is in front of you. Which test is distinguished human blood from the other species? So they want to ask you that human blood and the other species. Maybe the person is found any blood in the particular any other areas. Now we have to perform any tests for this particular blood. Okay, when we are going to do the perfect, we are doing the performing any test on it, and after the doing this performing the test, we will get to know that is really the human blood is there, or maybe the another species blood is there. Maybe it can be from the any animal or whatever is there, right, guys? We can get from the any animal. Maybe the blood which is seen on the by the person, it is from the any animal. Maybe anyone is doing the hunting or whatever, right? And he got the we see the blood from the animal. But now we have to perform the test. So in the forensic, we have to perform the test to the distinguish between the human blood and the other species blood, right? Yes, guys, very good, right? So for this test, which test we will do going to do, guys? As you see, you can see the option C is the Barber's test is for not for the blood test. The first thing you can clearly seen in this particular condition, right? It is not for that. It is not for that. The next, we already talk about the Techman test. In the Techman test, it is a confirmatory from the blood samples. Yeah, but it is not about, I didn't mention there in the particular Techman test that it is distinguished or it is defining other in the human blood or the other species blood. Right now, just left with the Takayama, and we left with the your precipitin test. Yes, so option B is your correct. Very good, doctors. You are replying very well in the chat box. You are replying very well, perfectly. Now I think I'm also getting confidence from you guys that you studied very well, and you guys will be going to rock in this FMT, right, on the 6th of July, all right. Very good, right. I'm also getting confidence from you guys, right. It is a good thing, right, okay. Yes. So if we're talking about it, if the what is your precipitin test? So in the precipitin test, we are getting to know about it, that this is the which blood specimen or which blood sample is collected or from the site of the crime or whatever, right. It is from the human blood or maybe from the any other species blood is there, right. So we have to do your precipitin test. If we're talking about this your precipitin test, just please understand the thing. It is a serological test. What it is, your serological test, which is using the precipitin reaction to detect the presence of the specific antigens, right. So what we are doing, yes, it is a kind of your immunological or enzymological uh, test is there, right. So this is a specific antigen from the particular human body. We having the our specific antigen, so it is serological test, right. It is used early, right. Nowadays is moreover, right. Up to बहुत सारे tests are nowadays. We can go with the your immunological or maybe like DNA test directly. We are going for the DNA test, okay. It is used earlier, but yeah, it is also distinguished. If we are talking about the particularly to distinguish about the your serologic about the your blood, human blood or the other blood, so we go with the your pigment test, okay, this test, okay. I hope you understand with this your precipitin test. Very good, let's move forward for the next MCQ. And in your front of you, which of the following characteristics is not the typically associated with a true bruise? So they want to ask you, like, which of the following is characteristically is not the typically associated with a true bruise, right. It is not from the true bruise. So option is given the negative chemical tests. Option B is given your progression of the color of bruise over the time. Option C is given your irregular margins. And option D is given your presence of itching. Presence of itching is there, right? So I'm waiting for your answers. Guys. Try to reply me in the chat box. I'm waiting for your answers, guys. It's quite easy. Please remember from the related to the bruise, yeah, progression of the color will be going to change. Color will be going to change from the over the time on the bruise, right? Color will be going to change. Okay. I think no one is knowing. Please remember the presence of itching. The presence of itching is not a typical associated with the only true bruise. Please remember. Okay. The option D will be the correct here. Presence of itching. Okay. The presence of itching is not typically related to your true bruises. Please remember about it. Related other yes, negative chemical test, it will be going to seen there, right. Your progression of the color, of course, it will be seen, right. And your irregular margins can be seen, right. From the irregular margins also can be seen in this case. But please remember your presence of the itching. Should be not the typically seen with the true bruises. Okay, right. Perfect. Okay, so it will be your presence of itching is the not the typical. Okay, not the typical. Okay, so itching is not the typical associated with the true bruises. Just a quite easy question. Okay, guys, let's move forward. No, that's bruise is clearly mentioned, guys. Please remember, not laceration. They bruise the mentioned. They mentioned bruise clearly. Okay, so please try to don't do such things in the exam. Okay, please try to read the question carefully. Read all the 4 options carefully in the exam and then think about it and then mark the answer. Okay, then mark the answer. Okay, the next question is in front of you. A male brought to the emergency room. On the examination, your pulse rate is your 50 beat per minute, right. The BP is just 80 by 60 mmHg, and the respiratory rate the respiratory rate is 7 breaths per minute. So you guys can see here, the everything is going to decrease in this condition. What is happening here? The everything is going to decrease. The pulse rate is decreasing, right? BP, blood pressure is also decreasing here. And the, please remember also the the breathing rate is also decreasing here, and the talking about the temperature is just 95 degree Fahrenheit, and the pinpointed people. Please remember, this is your key point of the pinpointed people. What is the most probably diagnosis? Very good, guys. Very good. What is the most probably? Guys, it will be not the cocaine. Guys, if you are replying B is not the option of the cocaine intoxication. In the cocaine, we just now only talked about it. In the cocaine, what is happening? In the cocaine, sympathetic nervous system is taking over of it. Okay, so what here not will be the sympathetic. You can see is the heart rate is increasing, is the blood pressure is, hypertension is seen, hyperthermia is seen, nothing is seen like that. Okay, so not the cocaine. Benzodiazepine overdose, not. Now the two thing is there which is going to confuse you. The one which is going for the about the opioid withdrawal. The option B is your opioid intoxication, which is the mentioned clearly in the MCQ. That option is twisting you. The examiner is trying to twisting you, confusing you between these two options very well, right? That it should be the opioid withdrawal or opioid intoxication. So please remember always and always, as the clearly is shown to you, that it is a case of your opioid intoxication, right? It is a case of your what? It's the case of your opioid intoxication. So the patient is used the opioid. So because of it, you can see, yes, the cocaine symptom will be just opposite. Just opposite. Okay. What was I shown you in the cocaine? The cocaine was, there was the pupil was dilated and fixed. What about here? What about here? Here, pinpointed pupil. Here, pinpointed pupil. Also, there was in the cocaine, there was the increasing the heart rate, tachycardia was seen. Here you can see the your pulse rate is decreasing near the 50. The next, blood pressure, if we're talking about the blood pressure was increasing in the cocaine. There was the hypertension was seen. If we're talking about here the blood pressure is decreasing. Here blood pressure is decreasing. Also your respiratory rate is also decreasing. Your respiratory is also rate is decreasing. And if we're talking about it, the people, it's the pinpointed, right? So please remember about the opioid intoxication, right? Opioid intoxication, right? Very good. Yes, it can be seen on the withdrawal symptom. You can see in the hallucinations, tremors, the anxiety will be in the patient. Many things can be seen in your withdrawal. This thing will be not seen on the withdrawal. It will be seen in the particularly on your intoxication of opioid, right? Very good. So the answer should be your corrected what? Correct answer is your opioid intoxication. Opioid intoxication. So please remember your symptoms of the opioid intoxication. You have to remember always that opioid intoxication is can be including what? Altered mental status, such as a patient is remembering, confusing, or in the delirium, or decreasing the awareness of the responsive, and also the breathing problem is the important. And I already mentioned that pinpointed people you have to remember. Pinpointed people you have to remember always and always, right? And the breathing may be slow or eventually is stopped also. So as I talked to you, breathing may be slow. So you can see in the MCQ, the clinical question which they given, the 7, only the 7 breathing rate was there. So it was getting slower, right? It was getting slower on the, as the, rather than the normal, it was very slow, right? So it is about the your, opioid intoxication. It is about your opioid intoxication. Just remember about it. Just remember about it, right? Next question is in front of you guys, again from the test. And now you can see 3 questions back to back come from the test. So I hope you can see, you can remember this. The tests are very, very, very important for you guys, right? So please, now my request to you, before going to the exam, right, just check it out again about the all the tests which is done in your forensic medicine. The second, which is moreover the again coming, I'm again telling you, you have to see your sexual offenses. So the sexual offenses about the test you have to see very well. The third about the cocaine and the opioid. Remember please, opioid and cocaine frequently they repeatedly time they asked you. So please remember about the test and about your sexual offense and about the opioid intoxication and your your cocaine intoxication, right? So please try to revise it and then go for the exam, right? Maybe they can ask you same questions repeatedly this time also, maybe, right? The maybe word is there, right? I'm not saying they will ask, right? Maybe they can ask you, right? So the question is there again from the test, and in this time they are twisting this question. And what they ask you, yes, what they ask you very well, guys. They ask you, guys, not the C, not the C. Please read the question carefully, doctor. Which of the tasks subsequently tasks not applicable for the identifying the blood states. So it means they are asking you which is not, or they can ask you which is accept, right? Identifying in the blood stain, accept which test. Okay, so you guys already know about the Takayama, about the Techman, about the streptoscopy. These all are for the blood only, and you already know your Barbios is done for what? Your Barbios is done for what? Yes, your Barbios is done for your semen stains, right? It is done for the semen stains. We talked about the Barbios very well. In the starting of the session only, we talked about the Barbios, right? So remember, the Barbios is done for the semen analysis, not done for the blood. Yes, we talked about the confirmatory test was your Techman test. Just last 3 to 4 questions previously we had talked about it, doctor, right? It was the Tickman test about the confirmatory test of the blood stains. But if I'm talking about which is not applicable, guys, please don't be in a hurry. Don't be in a hurry. Just read the question carefully. Just read the question carefully. What the examiners exactly want to ask you. Okay. Just don't be in a hurry. Just read the question carefully, that what the examiner want to ask you. Okay. So examiner is asking which is not for the blood stain, right? Out of this all the tests, which is not for the blood stain, right? It is your Barbios test. The Barbios test is done for the semen. Barbios test is done for your semen. Okay. So for the semen, Barbios test is done. Okay, doctor. I hope it's clear now. I hope it's clear now. Right. Okay. I think again for the Barbios test, I don't have to give you so much. I already given. You already know the Barbios is done for the sperm or the semen, right? Confirmation of the semen. Very well. Very good. The next question. The next question is in front of your screen. Who is responsible for handling the investigation in the case of custodial death? So now in the case is present to in front of you, and what they are asking you, they're asking you the thing that who is responsible, right? Who is responsible for the handling of, who is the responsible for the handling of investigation in the case of custodial death? The option A is given here, police inspector. Option B is the jail superintendent. Option C is the superintendent of the police, and option D is your judicial magistrate, right? Your judicial magistrate. I'm waiting for your answers, guys. Very good, very good. What is the meaning of custodial death? Please remember about it. The first of all, I have to talk about the thing that what do you mean by the custodial death? What do you mean by the guys custodial death? It means what is happening? It means the person was in the custody of the police. Okay, like I'm giving you the example that a person is there who had some crime. So now the police keep that person into the jail, and he is in the custody of the police, and due to some circumstances or anything will be happened in the custody, when the person was in the custody and he died in the police custody. So now who will be going to investigate in this particular case? Who will be going to investigate this case? Again, the same thing, the police inspector, not possible, right? Because it is already in the police custody, right? Already is in the police custody, the police inspector is not possible. Jail superintendent will be not. The answer should be here, guys. Very good, your judicial magistrate. And now one more question to you guys. In which other kind of death, in which other kind of the case of the death, there will be your judicial magistrate will be going to do the investigation? Can any one of you can mention me in the chat box, guys? Can any one of you can mention me in the chat box any other type of death which is investigated by your judicial magistrate, right? Let me know in the chat box. I'm waiting for your answers. I'm waiting for your answers, guys. Very good. Right. So what is about it? What is about it? Yes, it is the judicial magistrate, is also known as, guys, your metropolitan also. So in the some space we are doing with the metropolitan magistrate, right? We are giving in the Metropolitan Magistrate, and your Executive Magistrate is also, the name is given, right? Or the police is holding any query of the investigation in the case may be in the section of the 1A, that shall, what will be happening in this, that within the 24 hours of the death of the person which is in the custody, right? In the custody, there will be the, due to in the custody, as the person is in the custody, so now the person who is having the body will be being by the examined by the nearest civil surgeon also. So the two things are saying, the your 176 CRPC, 176 CR, yes, very good, your 176 CRPC is saying. So 170 CRPC is what saying? It is saying that the judicial magistrate will be going to see the going to investigate this police holding person who is getting died, right, in the custody. The second thing, the 176 1A is saying what? 1A is saying that this particular body, which is the dead body is there, it should be sent to the your civil surgeon to examine, doing this examine of this body, to viewing examine of this body under the 24 hours. So please remember 176 is what saying? 176 is saying for the judicial magistrate, that the custody, the investigation will be done by the judicial magistrate, and 176A 1A is saying what? It is saying that body should be sent into the within the 24 hours. Within the 24 hours. Very good, guys. Yes, very good. In the dowry death, please remember about it, in which the magistrate will be due. In the custody, we talked about the custody. The next is your dowry death. Okay, not the case of dowry. In the dowry death, there will be the magistrate will be going to come, right? The magistrate will be do the investigation. Okay, so there will be the in the dowry death. In the dowry death, it will be seen. Yes, custodial rape is again the custody. In the custody, anything will happen. In the custody, death will be happen. Custody rape will be happen, right? It both will be done. Both will be done by the your judicial magistrate or the executive magistrate. If we're talking about any other, custody is done. Okay, in the custody, maybe rape is there, maybe death is there. If we're talking about other than the custody, this is the dowry death. It is seen in the dowry death. It is seen in the dowry death, right? Magistrate, right? Judicial magistrate. Very good. Okay. That was in, yeah, magistrate inquest is also exhumation. Yeah, digging out the bodies also. That is also done. That is also done, guys. Very good. That is also done. Perfect. Now in front of you, the image is given, and they're asking you what? They are asking you about that, they identify the type of homicide. It is not the suicide, it is the homicide. You can see the person want to kill that particular, the both of the person want to kill that lady, right? And you can see what is known as, and you can see here what is the happening. This person is blocking the nose and the mouth of the person, right? The first of all thing, and with the doing this, you can see the second person is sitting on the chest of that lady, right? And it is also trying to do the homicide of this person, right? So what it will be knowing as, right? So option is given as the one is the mugging, option B is given as the gathering, option C is given bucking, and option D is your Bansadola. Very good, guys. Very good. You guys are replying very well. It should be what? It should be your bucking. Very good. It should be known as your bucking. It is your types of homicidal that, right? It is a type of homicidal, right? It is that which type of this? It is a type of homicidal type of the death. Very good, right? So what is happening in this bucking? Please remember about the bucking. If I'm talking, bucking is a method of homicidal, and it is not the one thing. It is having the two things combination here. What the two things? The first thing is the snottering. You can see the first person was doing the snottering, right? He keep the what? He is closing the mouth and the nose, right? The first thing. Also, the second one is the thing is included here. It is known as your traumatic asphyxia. So you can see the person who was sitting on the chest of that particular lady, right? The person who was sitting on the chest of that particular lady. So what he was doing? He was doing the traumatic asphyxia there. He was doing the traumatic asphyxia, and the first person was doing the smothering. So the two things will be the combination in your bucking. Bucking is not only the smothering. If the one person is only doing the closing of the mouth and the nose, it will be clearly known as, it will be clearly what? It will be known as your smothering. It will be known as smothering. But if the combination of your smothering, and the traumatic asphyxia, that should be known as your bucking. That should be known as your bucking. Right? Very good. Very good, guys. Very good. Okay. Let's move forward for the next thing. Talking about the next MCQs in front of you, guys. According to the law, nothing is an offense if person, right, of an unsound mind. So if an unsound mind patient is doing any offense, it is not the, according to the law, it is not the any law. Okay, it is not the offense, right? It is nothing is law is nothing is an offense, right? And which rule of insanities apply in these cases? So we have the rules of insanities also available there, right? So they're asking you about what, which rule is there, which rule is doing that the person, if the unsound mind person is there doing any offense, it is not counted, right? It is not counted it. And the option is given your do harms rules. The option B is your Magnoton's rule. Option C is your currents rules. And the D is your unstable impulses rule. And I hope you always remember this. Yes, it is a very, very important. It is your Magnoton's rule, right? It is your Magnoton's rule, right? Very good, guys. Very good. You know about it. This is your what? It is your Magnoton's rule. It is your what? It is your Magnoton's rule. And please remember what is happening in this Magnoton's rule. In the Magnoton rules, it is happening due to the what? It is the due to your, the person is the unsound mind, is had any what? The patient is had any offense. It is not counted as the offense, right? So that's why it is for the insanity. It is for the insanity, right? Let's talk about it. What is your Magnoton's rule? If we're talking about your Magnoton's rule, in the Magnoton rule is also known as your Amnoton's or Amnecton rules. It is having the synonym. Yeah, it is not the liable for it. Okay, so he's not liable for the punishment, right? So he can do any offense, right? Criminal, he will not known as the criminal. Okay, he can do any offense if the patient is there, right? So it is a legal task. It is a legal task used to determine the chemical responsibility for the individual based on the mental state. Please remember, at the time of the offense. So if any person is having the insanity, right, and have the any offense, right? So it is a rule. In under this rule, we are checking that what the person is having this legal task to determine the criminal responsibility, that individual having which kind of mental state at the time of that offense. Okay, right? So this is the Magnoton rule. Magnoton rule. Very good. It is the 84 IPC. Very good, doctor. Very good. You know about it, right? 84. IPC is 84 here, right? Very good. Right? Should we move forward? Right? Next. The next MCQ is in front of you. All of the following changes occurs in the starvation except. And again, they mentioned the chronic starvation. The two MCQs again and again coming from the starvation. Can you guys imagine this? That this is the particular also. This topic is also the important topic, right? This topic is also your very important topic, because again, they asked you about what? First, they asked you about your in the chronic starvation. They asked you about what? They asked you about the descended gallbladder, right? What they asked you? They asked you about the descended gallbladder. And the next, now what they are asking you? Now they are asking you about this thing. Guys, can anyone of you can reply me in the chat box? Can anyone of you can reply me in the chat box? What will be the answer here? What will be not the scene there? Exactly, if I'm talking about it, what will be not the scene? As we already talked, I hope you remember, descended gallbladder will be seen. All right. Okay, rather than other things will be getting, other organs will be getting shrink down, right? Shrinkage. The other organ shrinkage will be going to see. Other organ shrinkage will be going to see, right? We talked about it. Very good, right? Now tell me, what will be seen out of this? I'm not getting anyone's answers in the chat box. Guys, did you done with all the previous year MCQs? Sure. Or just doing with me now, right? If you didn't done, please do with me now also. Please remember, Your option will be here, your hyperthermia will be not here. What will be not going to include it or the accept if I'm talking about it, it will be what? It will be your hyperthermia. So in the case of chronic starvation, what will be not in the following changes? There is a hyperthermia will be not seen. Hyperthermia will be not the scene. If we're talking about it in the depth, what is happening? Yes, please understand this topic. In the chronic starvation, the particularly body, the chronic starvation, as the patient is not eating anything, the patient is on the starvation, not the hypotension, doctors, please remember about it. It is a hyperthermia. It is a hyperthermia. And why about the hyperthermia? Please remember about it. I'm explaining you the things why the hyperthermia is not the scene, not the scene. As your body is from the chronic starvation, the mention as the chronic starvation, so patient is not eating anything, and the body is, then importantly the body is having the decreasing the BMR, basal body's metabolic rate. You can say the body metabolic rate is very decreased, and you already know if the body is doing the metabolism, then only the heat going to produce in our bodies, right? So the heat is produced by the body. So in this case, the patient is not having hyperthermia, right? So the patient is not having the hyperthermia in the chronic starvation, in the case of chronic starvation. Is it clear to you? Right? Please remember about it. It is an important question. Maybe they can ask you such questions. They can ask you such questions, guys. Please remember about it. Okay. Right? Should we move forward? Okay. Let's move forward for the next. Let's move forward for the next. A 32-year-old worker was brought to the emergency room, consumed local spirit. So the person is what? The person is what the done by the patient, right? Right? The patient is done what? The patient is done. The worker is done what? Consume the local spirit. And which of the following is the treatment? The patient is clearly asking you. Clearly they mentioned that had the local spirit is there, so we have to give what the treatment should be given in these cases. So the option is given you first, which is your fomepizole. Option B is your fomazillin. Option C is your N-acetylcysteine, and option D is your naloxone. What should be your answer? What should be your answer, guys? I'm waiting for your answers. Very good. Who all guys are watching live? Please reply. Please reply. I'm waiting for your answers. I'm waiting for your answers. Try to reply. Try to reply. Try to reply your answers. Try to reply, guys, your answers. Very good. Very good. Right? So it should be what? It should be answer your fomepizole. Right? What should be your answer? The answer should be your fomepizole. What is a fomepizole, right? If you're talking about this particular drug, it is an antidote, right? Fomepizole is your antidote. And what is the antidote? Yes, the fomepizole is used antidote for your methanol poisoning, guys. It is used in it is used in your methanol poisoning. It is used in your what? It is used in your methanol poisoning. Okay, as clearly mentioned in the MCQ, that person is having what? Person is had what? Person is had the local spirit, right? So it is about the methanol, right? So the fomepizole is your antidote for your methanol poisoning. I hope you remember this, right? Let's go for the next MCQ, and the next MCQ is in front of your screen. What does the observation of contracted hand with no primary relaxation during the postmortem examination is indicated? Again, the same topic is revised. Guys, can you see in the MCQ, as I collected all the previous year MCQs here, right? So here also it's repeated. Here also it's repeated, right? Yeah. If Tell me, thus clearly the question is again repeated in front of you, right? So what does the observation of contracted hands? Again, the contracted hands with no primary relaxation. We talked about it clearly. I mentioned there will be the no primary relaxation will be seen, right? During the postmortem examination, what will be going to indicate it? A option rigor mortis, option B lever mortis, option C cadaveric spasm, and option D is your alger mortis. Alger mortis. Very good. Very good, guys. Very good. It should be your cadaveric spasm. What? It should be your what? It should be your cadaveric spasm, right? It should be your cadaveric spasm. We talked about the cadaveric spasm. I hope you remember about it. The glass was in the hand of the drowning person, right? In the case of drowning, the patient is having the glass in the hand, right? We talked about it very well for the cadaveric spasm. I hope you remember about it. Just again remembering you that cadaveric spasm is a condition which the group of muscles were used profusely just before the death, right? Just before the death person is having, right? Right. So this will be going to stiff rigid immediately after the death, and thus not having the primary relaxation. Please remember, it is not having the primary relaxation in the cadaveric spasm, right? Very good, very good. Let's move forward for the next MCQ is in front of you. The next MCQ is in front of you. What is the term used to describe the comprehensive examination of the death in all aspects, right? So what they're asking you about the describe the comprehensive examinations of death in the all the aspects. Option are given: A, thanatology; option B is your forensic anthropology; option C is your toxicology; and option D is your molecular death. So what should be your answer, guys? Quite easy answer. I hope in the starting of your FMT subject you studied about, you learn about this thing, that yes, that the comprehensive examination of that is known as your, it is known as your thanatology. Okay, it is known as your thanatology, right? So the thanatology is what? Yes, the thanatology is doing the examination of, doing the comprehensive of the death, right? In the all the aspect, any aspect you are going, it will be the thanatology, known as the thanatology, right? Let's talk about the thanatology. Yes, the thanatology is the your scientific or the discipline that examine the death from many perspectives, as we talked about, like including the physical, maybe they can physically examine, maybe ethical, maybe spiritual, maybe medical, maybe serological, or maybe can be the psychological also. Guys, please remember, maybe can be psychological also. In the thanatology, it can be from the any aspect we have to examine the death, right? We have to discipline that the examine the death, right? So this is known as the thanatology. This is known as your thanatology, right? I hope you remember this. Next, should we move forward? Yes, the next is here in front of you. The medical termination of pregnancy can done up to 24 weeks in case of. Now tell me what should be the your answer, that in this case what they given, that in which cases we can do the medical termination of the pregnancy into the up to the 24 weeks. Option is given the congenital malformation, option B is the minors, option C is your contraceptive failure, and option D is your rape victim. Option D is your rape victim. I'm waiting for your answers, guys, in the chat box. Please try to reply. Please try to reply. Just think about it. Who guys are replying the A? Congenital malformation, we should done the task for it in the 15th week. Okay, 15th week that we can done this task, and you already know this is done for the your amniocentesis, right? Amniocentesis done, congenital malformation is seen by your congenital malformation can be seen on the USG scan also, right? And on the amniocentesis, we seen the other malformations related to the related to your chromosomal abnormalities also can be seen there, right? So it will be not there. Option C, we already just now I already told you, in the contraception failures will do till the 20 weeks, guys. Okay, till the 20 weeks we already talked about it. Yes, guys, it should be your rape victim. In the cases of rape victim, the pregnancy, the medical termination should be done, up to the 24 week, up to the 24 week. Very good, guys, very good. I hope you understand this particularly, right? Very good. So the FMT is having quite good and the clear cut, right? They are giving you the clear cut MCQs, right? So just one liners kind of the MCQs, some clinical case from the toxicology, right? They asking the clinical case also, and from the topic of toxicology, right? So the medical termination of the pregnancy is done for the 24 week in the cases of rape victim, Let's move forward for the next question. in front of you. And in autopsy, when the patient is done the autopsy, it means the we are doing the autopsy, right? So the no tattoo is observed on the skin of the patient, right? So as I can give you the example that, think about it, the patient is having the no tattoo is seen on the autopsy, but the we can say the relative of the patient is saying, no, the person was having on the tattoo on the, maybe on the arm, or maybe on the hand, or maybe on the neck, or maybe on the wrist, right? So for the, what is the best location to check the presence of the tattoo, right? Maybe there is a not the visible that tattoo maybe is on having the tattoo on the arm, but this arm is, now this arm is burned, or maybe not getting clearly visuals are there in the autopsy, so we cannot see the tattoo is not observed clearly, thing is there, right? So what we can see, how we can identify that yes, the patient is having the tattoo. So what is the best location to check this? Maybe the spleen. Is the spleen is the possibilities? No, guys, spleen is never ever is the possibilities, right? How the spleen, the dye of this ink of this particular tattoo is going to the go to the spleen, right? It is not possible. What about the liver? Liver, again, the liver is not possible. The option can be the confusing in between the B and the C. Maybe in the artery, but the artery, as it having already related to this, the arteries cannot be there, guys. Yes, exactly, it should be always and always what, it should be your lymph node, it should be your what, it should be your lymph node. So what we have to do, we have to see, we have to do the regional lymph node, guys. Please understand, as the arm, the tattoo was confirmed by the family that patient is having the tattoo on the arm, so we have to see the regional lymph nodes of the, particularly from the arm, and we will get in the regional lymph nodes, will be find the tattoo ink surely will be there. If the tattoo ink will be presented there, the patient has had the tattoo. If not, the patient is not having the tattoo on it, right? So this is happening in the forensic medicine. We have to see the lymph nodes for the tattoo ink, for the checking the tattoo ink. So examine the regional lymph nodes. Please remember which lymph nodes we're gonna see. We're gonna see the regional lymph nodes might reveal the presencing of the tattoo, right? If the ink is presented there, right, some ink part of seen on this regional lymph nodes, it will be your, it will be the patient is having the tattoo on it, tattoo on this, right? So this is about the, this is about the your related to the autopsy, related to the autopsy. The next question is in front of you. The next question is in front of you. A gunshot victim is examined. The firearm injury has a stellated shape, right? What will be the range of the gunshot? Guys, please remember about it. The clearly mentioned in that a gunshot victim is examined and the firearm injury has the stellate shape. The stellate shape is there. What will be the range of this gunshot? They are asking you. Option A is here, close shot. Option B is here, contact shot. Option C is here, near shot. And the last option D is here, distant shot. What should be the your answers, guys? What should be the your answers, guys? I'm waiting for your answers. Very good. Very good, guys. Very good. It should be what? It should be your contact shot. It should be what? It should be your contact shot, right? Why the contact shot? Please remember, as they are giving you that, there is a having the stellate. So please remember, the contact shot occurs when the firearm is the direct contact to the victim's skin at the time of firing, right? So that in this case, what will be seen in this case, and the contact shot will see in the timing of the firing, right? On the skin will be the this particular, what the gunshot will be on the touching, right? It will be the direct contact of the contact will be on the, like this is the gun, so it will be directly going to contact it, right? It will be right into the contact it of the victim's skin, and they will be seen the stellate lesions, right? Stellate lesion. Remember about this gun, about the guns they are asking, about the injuries related to the guns they are asking, right? Okay, about this shot, near shot, close shot, right? They're asking you about it. Okay, very good. The next MCQ is in front of you. The next MCQ is in front of you, right? Burning, yeah, burning, blackening is also seen, right? In the context shot, absent, right? Everything is absent because the firing will be not the scene. In the near shot, they will be the scene, right? Yeah, burning, blackening, tattooing, everything is absent in the context shot. Very good, doctor. Very good, right? The next MCQ is in front of your screen. Yeah. The next MCQ is seen to your on your screen. A doctor was summoned as a public witness to the appear for the record his evidence in court. what is the correct about this witness, what type of this witness should be this doctor, right? So they're given the oral evidence, B is the common witness, option C is the expert witness, or option D is the hostile witness. So please remember, as the doctor is going to do this, as the doctor is getting this summon, right, for this particular doing this witness and appearing for this in the court, right? So please remember, as the doctor, he is going to evidence the court of again the record as he is recorded. The thing about it, like a rape case is coming to the your hospital and you was on the emergency department, right? You had given the all you done the all the examination and you given the report, right? So you give written there your name, you given your mobile number that you was the doctor on the duty, you did the examination there, right? So if this case is going to in the court, so they will send you the summon. What they will send you the summon to perform this appear witness, to appear as a witness, to this show your records, right? So that's why please remember, as the doctor or maybe any other expert is going to it, it will be conducted in, it will be coming in under the your expert witness. Why it is coming into the expert witness? Because they are the expert in this such things to do this such examinations, right? So that's why they are counted as your expert witness, right? So if I'm talking about the expert witness, please remember, an expert witness, someone who have the specialized knowledge, who have the specialized knowledge, skills, or the expertise in that particular field to reveal into the case, right? So please remember, doctor can be the expert witness, the mainly, as the question is asked there, right? If it is going as a commonly, if they asked, they call the person without the doctor, right? Maybe the doctor has done any crime, right? And he was the eyewitness. So the common witness can be there. Doctor can be go as a common witness. But please remember, as a clearly question the mentioned that doctor was the showing the records, to go to show the records, right? To evidence of that records. So please remember, in this case, the patient will, the doctor will be your expert witness. Okay, doctor, the patient, the doctor will be not the your, the doctor will be not their common witness. The common witness, when the common witness, when the patient, the doctor was seeing any thing has happened in front of you and the doctor is giving the witness that yes, this was happened there, right? So as a common witness is also called. But please remember, about if they are mentioning there clearly that about the record, please remember, someone the doctor was summoned for the public witness for the appearing for the record his evidence in court, right? So in this case, right, in this case, there will be there, right? Yes. Okay. So this will be the particularly related to your doctor will be coming into their expert witness. The doctor will be your expert witness. I hope it is clear to you about the witnesses. The question is in front of you next, that a case of road traffic accident presented with the EDH. Again, your extradural hematoma or extradural hemorrhage is there, and due to the involvement of your middle meningeal artery. I hope you already know about it. The EDH is done from by the your middle meningeal artery, right? Where will be the impact of convolution will be. Now tell me, at which place there will be the seen the your the convolution will be seen on the which part of the your skull. So there will be the middle meningeal artery will be getting ruptured, and due to this there is an extradural, right, your epidural hematoma or epidural hemorrhage will be seen. So the options is given the Patreon, the option is B is given your angle of mandible, option C is given the lomboid suture, and option D is given the nasocial, right? So yes, very good guys, very good, right? So this is about your pterion. Yes, it is about the pterion, right? It is most commonly. Just I'm going to show you the pterion. About the pterion also we'll talk about it. So it is talking about the pterion. The most commonly your EDH is seen. EDH is seen in about the related to the pterion due to the, if they can ask you about the which artery. So please remember middle meningeal artery, right? Middle meningeal artery. So please remember, an epidural hematoma is your EDH is due to the involvement of the middle meningeal arteries likely occurred to the pterion. And what is the pterion, guys? The important thing, if I am asking you that what is the mean of pterion, so you guys can see in this image, this is the part of your skull. This is the part of skull is your, this is the part of your skull is your pterion, right? So this is the part of the skull of the pterion. So they can give you in the clinical MCQ that this person is having the road traffic accident, right? Not wearing the helmet, or maybe they can give you the cricket ball, right? Cricket ball hit on the patient's cricket ball hit on the patient's skull, and the patient was in the, maybe they given it the clinical scenario of lucid interval. The patient was unconscious. Then after the sometime the patient was getting consciousness, and again now in the unconscious, right? So they can give you such kind of the scenarios, right? They can give you the such kind of the scenarios. So just please remember about it. It is part of the pterion, is the part, this part of the pterion, this part is known as your pterion, right, of your skull, and it is having the what? It is having the middle meningeal, due to the rupture in the middle meningeal artery, and due to this, there's the happening of your EDH, epidural hematoma, right? Very good. Middle meningeal artery, pterion fracture, lucid interval, EDH, lens shaped or the idli shaped, burr hole surgery should be done in this cases. Very good, doctor. Very good. All right. Perfect. So this is about your question. The next question is in front of you guys. The graph despite the postmortem cooling process. So the what they are asking you, the graph which is showing the postmortem cooling process in the typically expected in the what the shape. So they are asking, right? So they are asking that the graph of the cooling, the graph of the postmortem cooling is in which shape, typically in which shape, expected in which shape. The option is given, your hyperbolic, option B is given your sigmoid, option C is given your linear, and option D is your parabolic. Now please reply me. Very good, guys. I hope you already know that this will be, should be your always and always which shaped? Sigmoid shaped. Which shaped? Yes, it should be always and always which shaped? It should be always and always into your sigmoid shape of the your postmortem cooling. So it will be in the your sigmoid shape, right? Not the linear, doctor, not the linear. It should be sigmoid shape, right? So please remember the body cooling gradually. Please remember the body is cooling gradually. At the first reach the midpoint and then cools more rapidly, right? So it will become like that. So it will be reached to the midpoint and then suddenly there will be the cool rapidly. So it will gradually, slowly it will be going to cool till the midpoint, and after the getting the reach to the midpoint, it will be going to cool the more rapid. So it will be your which type? It will be, should be always your sigmoid type of it, right? Sigmoid type of it, right? And with this, we cover all the important previous year questions of your forensic medicine and toxicology, right? I hope you enjoyed this sessions, guys. Again, I'm mentioning you here. I'm mentioning you here my both of the social media's handle, right? My Instagram handle is also given here. My Telegram user handle is also given here. If you have any queries related to this or related to any exam, any help from my side, you guys can contact me on both of it, right? Right. I hope you enjoyed this session. If you enjoyed this session, one thing which I'm going to ask you, please like this session and please comment after the, as I'm going to upload this session just now, right? So please, after the ending this session, I will upload this session. Please try to reply. Please try to reply in your comment box. In the comment box, please try to give your feedbacks, right? I'm waiting for your feedbacks and comments. And as the exam is very near, guys, just my recommendations, 2-3 recommendations to you, all of you guys. I will take just 1 or 2 minutes more from you guys. Just please remember, uh, please revise all the previous year question, which is more important. And in this last days, please don't go for any new topic or any for the new things which you never ever studied. Okay, so don't go for such things like you never studied any topic and now you are thinking that I will read this topic now or read this all the, right? I will not I will go to read this topic and it will come into exam and whatever. So don't go for this such things. Whatever you studied, please try to revise that content. Please try to revise that content. Don't go for the don't go for this reading the new topics. The second thing, nowadays moreover, I'm seeing your friends or maybe your colleagues will be going to call you and give you that I will send you some PDF, please read at the last moment of the time and you will going to remember everything like that. Such things will be such kind of the PDFs. Please don't believe in such things. Which notes you studied for any subject, I'm not saying that you can not use this. Please remember that use your own source which you studied at the time of study. So revise from that notes only, that source only. PYQs you can do from anywhere. Already on the MaduHub channel, you can go and you can see all the subjects are already uploaded there. You can watch the subjects now as the video is uploaded there. So on the 2x also you can directly go and you can watch there, right? Okay. And please remember, right? Sure, will do, right? Images questions you are asking 1 or 2 hours in the next 4 days, whenever. Okay, sure, we'll plan about it. Surely we'll be plan about it and we'll take this session, right? Just remember such things. Don't do new topics. Don't go for the any other new sources. Whatever you studied, please revise that. Do more MCQ. Do more previous year questions. And this is the thing. Please keep your sleep cycles well, right? Don't do such things that you are reading for the more time, just taking sleep of 2 to 3 hours. Please keep your sleep cycle also well. All right. I hope you enjoyed this session, and this sessions will be going to help you in your exams. All right. And thank you so much for joining this session. And again, best of luck from my side, right? And the team MaduHub also, right? Best of luck from my side and the team MaduHub to all of you, right? For your examination, right? I'm waiting for your replies, right? I'm waiting for your replies. When you guys will be going to pass, you will going to surely message me or message the MaduHub also, right? Thank you so much, guys. Thank you so much, right? Best of luck. Best of luck.